We're going to move on to Part 5. How does an individual transition off of Medicare after disability eligibility ends or when the individual who is under 65 returns to work? So when a person is no longer considered to be disabled, Medicare eligibility stops at the end of the month following the month of notification to the beneficiary. Clearly, if a beneficiary is notified and they disagree, there are appeal rights that come in the notification. But Medicare will not end if the reason for eligibility would end is only because the individual returns to work. Then Medicare may continue. So let's look at those individuals. So Medicare would continue during the 9-month trial work period, followed by a 93-month extended period of eligibility after the end of the trial work period. So that's a total of 8.5 years, followed by an indefinite period following the 93 months, as long as there is, the individual continues to meet the medical standard for disability under the Social Security rules. That option for coverage is available to them. Then following the extended period of eligibility, that 8.5 years, if an individual still is working with disabilities, they may have the option of receiving benefits from Medicare as long as they are medically disabled. They must continue to be under the age of 65, and then they have to pay Part A and Part B premiums. I'd note that the Qualified Disabled and Working Individual Program is something that may be available to help for a low-income individual. So it's important to look to see if someone in this situation is eligible for QDWI. Individuals may suspend their Medigap policy benefits and premiums without a penalty if they become enrolled in a group health plan. They have to notify the Medigap plan within 90 days of the individual's loss of a group health coverage for Medigap to be reinstated. And let me just back up for a second and say here, this is where someone who has decided that perhaps they'd rather be on the group health plan of the company that they may be working for, or they have other group health plan options through a spouse or another family member. They have the right, again, to suspend their Medigap policy. And by suspending it, and then if they need to come back on because they become disabled or there's some other reason why the group health plan doesn't work out, perhaps the job doesn't work out, then beneficiaries are entitled to the same benefits and premiums as if the coverage had never been suspended. There are no pre-existing condition refusals. It gives somebody who is really trying to work the opportunity to kind of turn back and freeze their Medigap benefits. And finally, I want to note, because I think this is important for people to know, if an individual, for whatever reason, has incurred penalties and continues to incur penalties when they received Medicare benefits and they were under the age of 65, every individual is entitled to another initial enrollment period at age 65. So it's the same initial enrollment period as for individuals who are aging into Medicare. As people who have disabilities may have been covered by Medicare as a disabled person are aging into Medicare, they have an opportunity to reset their benefits, if you will. And if they've incurred any payment penalties, they can eliminate them by resetting their benefits and contacting Medicare and Social Security, who does the enrollment at eligibility, and signing up for Medicare as aging into Medicare.